Hello everyone, welcome to Pediatrics by Dr. Anand. Today's topic of choice is clinical teaching. So this baby, 5 days old term baby, had come to us with a condition like this. If I open the mouth of the baby in this video, can we appreciate a defect in the posterior side? Can we see that? Like I'll show you now. So once the baby starts crying, you will see a wonderful defect. Can we see this one? Yes. So what is this defect? This one is nothing but cleft palate. This is nothing but cleft palate, right? We have something known as cleft lip and something known as cleft palate. So in this video we're going to talk about some 10 to 15 important points which are important for MBBS, MD and DM students regarding cleft palate. So question number 1, which is the most common congenital anomaly of the facial structure? The answer is cleft lip or cleft palate. The most common congenital anomaly of the facial structure is cleft lip or cleft palate. So what are the etiologies? What are the etiologies of cleft lip and palate? Number 1, familial. Like if there is a family history, out of 25 live births, one case can have a cleft lip and palate if there is a positive family history. Okay, other etiologies are like rubella infection. Number 3, the examiner keep asking you what are the syndromes associated with cleft lip or palate. The answer is like various, like Pierre-Robin syndrome, Klippel-Feil syndrome, Down syndrome, Treacher-Collins syndrome, Apert syndrome, or various trisomy. What are the other etiologies of cleft palate? Maternal epilepsy, or any history of taking steroids or diazepam during pregnancy, the baby can land up into cleft lip or cleft palate. Next important question we have, what are the various classifications of cleft lip and palate? So we have various classification. The first classification is cleft lip alone. The cleft lip alone could be unilateral, bilateral, or median. That is the classification of cleft lip. Then we have cleft of primary palate and cleft of secondary palate. Okay, cleft of primary palate and cleft of secondary palate. What is this primary palate or secondary palate? Like the primary palate is in front of the incisive foramen. I'll show you a picture. You will get to know what is incisive foramen. So can you see this picture? In this picture, can you see there's a pointer known as incisive foramen, right? So if there is a cleft in front of the incisive foramen or behind of the incisive foramen, so that is what the classification is: cleft of primary palate, cleft of secondary palate. Cleft of primary palate means which is in front of this incisive foramen, and cleft of secondary palate is behind the incisive foramen. Okay, these are the various classification in general you need to know of the cleft lip and palate. So coming to other important questions, like how many percent of cases do you see unilateral cleft palate or bilateral cleft palate? So remember, 75% of cases the cleft disorder is unilateral. In 75% of cases the cleft disorder is unilateral, and most common is on the left side. Left sided cleft lip is very common, 60% cases. Okay, I'll repeat again, 75% of cases you see one sided or unilateral cleft disorders, and in that one side, left side is very common. If I talk about combined cleft lip and palate disorders, 50% cases you will see combined lip and palate disorders, and that is like 1 in 600 live births. And last, only cleft palate which my patient is having, you can see right now the cleft palate, 25 to 40% only cases you see on cleft palate alone. Okay, number 1. Number 2, it is more common in girls. Number 3, 1 in 1000 live births you see cleft palate alone, which is very rare and which you can see in my patient. So next question is, what are the problems a cleft disorder patient can face? The most commonest problem he can face is sucking and swallowing, not able to feed, yes or no? So yes, the patient will have difficulty sucking and swallowing. Number 1, defective speech. These patients will have problem in speaking some words in future. So these babies cannot speak B, D, K, P, T or G, these speech, these words defect they will have. They will also have altered dentition, or even some cases we have seen supernumerary teeth. So what is supernumerary teeth? Lot of teeth at one place is known as supernumerary teeth. The most commonest location for supernumerary teeth is in the incisors. It's an exam question. And commonest causes of supernumerary teeth are cleft lip, cleft palate, cleidocranial dysostosis, and Gardner syndrome. Coming back to the another problem, chronic otitis media. The babies of cleft disorders can have chronic otitis media, middle ear problems, cosmetic problems, and upper respiratory tract infection. These all are the problems of cleft lip patient can have. What is the treatment of cleft lip? Of course, surgery is the best intervention. We have something known as Millard criteria. Millard criteria. MILARD. Millard criteria. What is this Millard criteria? It's an exam question. There is something known as rule of 10. Rule of 10. In the Millard criteria, there is something known as rule of 10. Means the baby should be at least 10 pounds of weight. The baby should be at least 10 weeks old, and the baby should have at least 10 gram of hemoglobin before the surgery. So 10 pound weight, 10 weeks old, and 10 gram of HB should be there. That is known as rule of 10, and that is known as Millard criteria, MILARD, which is seen in that as a treatment of cleft lip. Okay, now coming to the timing of surgery for cleft lip and palate, which has been a very important exam question. Always a question have been asked from this newborn baby has come right now with cleft palate. Am I supposed to send the baby to a pediatric surgeon tomorrow itself, or should I do something about it? So what is the timing of surgery for a cleft lip and palate? So as far as the surgery is concerned, it's a very wonderful table I have shared with you. This is from Bailey and Love. So this table says very important. It depends. Is it cleft lip alone, cleft lip palate alone, or both cleft lip and palate? If it is only cleft lip, it depends. It is unilateral or bilateral. If it is unilateral, I will operate at around 5 to 6 months. If it is bilateral, I'll operate at 4 to 5 months. That is for the cleft lip. Okay, alone. Unilateral 5 to 6 months, bilateral 4 to 5 months. If I talk about cleft palate alone, again it depends. Is it involving the soft palate only or soft and hard palate? Okay, like if the cleft palate is only involving the soft palate basically, so you'll do the operation at 6 months. Roughly all the operation are they doing at 6 months. Okay, and if the cleft palate is involving both the hard palate and the soft palate, then you'll do two operation. Soft palate repair you'll do at 6 months, and hard palate you'll do at 15 to 18 months. Like you can see in my patient, you can see the hard palate was there, but behind the soft palate part there was the problem. So roughly at 6 months of life they will do the operation. And last, cleft lip and palate together, then again it depends. Unilateral is it, or is it bilateral? If it is unilateral, again you will do two operations: cleft lip and soft palate at 6 months, and hard palate and gum pad at 15 to 18 months. Whereas for bilateral cleft lip and palate, again two operations, same cleft lip and soft palate at 4 to 5 months, and hard palate at 15 to 18 months. So it's a very important picture. By one line, like with one go, you will not able to remember or retain this slide, but it's very very important. It has come multiple time in exam. At least the key home message which you can take in this question is that you do not operate on the spot. You do not operate a neonate next day for cleft lip and palate. Normally 6 months, 6 to 8 months is rough time which you do. Okay, and that's it. And cleft palate, if I talk about, then soft palate you will repair at 6 months, and hard palate you will repair at 18 months, 15 to 18 months. That was all about cleft lip and palate and clinical teaching. I hope you liked the video. Please like, share and subscribe, and let me know if you want to study or discuss any other clinical case which you want to see in your daily practice. And thank you so much for watching this video. Have a wonderful day ahead, and for more such updates you can join my free Telegram and WhatsApp group. The mobile number is 9999897081, and for the international students you should add +91 before the mobile number. So hope you're studying well, and make yourself proud, and thank you so much, and bye bye.